Greetings. Today I will be discussing the oxygen therapies unveiled, EWOT versus HBOT for health and longevity. Oxygen isn't just another element, it's the currency of cellular survival. Every heartbeat, every neural spark, and every mitochondrial ATP molecule depends on oxygen's seamless delivery. Yet modern life's sedentary habits, environmental toxins, and chronic stress starve our cells of this vital resource. Enter two revolutionary therapies, EWOT, exercise with oxygen therapy, and HBOT, hyperbaric oxygen therapy. One rebuilds your microvascular system, thereby having a major positive impact on all chronic health conditions, while the other rescues tissues in acute crisis. Let's dissect their science, strengths, and why your mitochondria are begging for both. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC-Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Developed by physicist Manfred von Ardenne in the 1970s, EWOT combines moderate exercise, cycling, walking, with breathing 90 to 95% oxygen via a mask. This creates a demand-driven oxygen surge that forces dormant capillaries to reopen, stimulates angiogenesis, new capillary growth, elevates systemic CO2, signaling hemoglobin to release oxygen point. The von Ardenne breakthrough, von Ardenne's Oxygen Multi-Step Therapy, OMT, now called EWOT, revealed that aging and disease correlate with microvascular collapse, capillary loss, and cellular hypoxia. His key findings: EWOT increases capillary density by 17 to 45% in sedentary adults within weeks, restores youthful arterial PO2 oxygen pressure while lowering venous PO2, creating a steeper diffusion gradient that drives more oxygen into the tissues. Long-term oxygenation improvements persist for months post-therapy. Brain revival increases cerebral blood flow by 30%, reversing hypoxia in Alzheimer's, Parkinson's, and post-stroke recovery. Flushes amyloid plaques via lymphatic drainage to chronic disease reversal. Diabetes restores limb capillary density, preventing neuropathy. Heart disease resolves microvascular angina, small vessel chest pain. Long COVID repairs lung/brain microvessels and mitochondria. 3 mitochondrial overdrive oxygenates mitochondria, boosting ATP production and reducing fatigue. 4 detoxification flushes lactic acid, cytokines, and metabolic waste via enhanced circulation. Pro tip: EWOT's switching mechanism reactivates endothelial ion pumps, reversing capillary constriction caused by hypoxia. HBOT involves breathing 100% oxygen in a pressurized chamber, 1.5 to 3 ATA, forcing O2 into plasma and tissues. Key applications: FDA approved, carbon monoxide poisoning, decompression sickness, diabetic ulcers, radiation injury. Neuroprotection reduces brain swelling post-stroke/TBI. Anti-inflammatory suppresses cytokines in autoimmune disorders. Limitations: no microvascular repair, saturates tissues but doesn't rebuild capillaries. Passive therapy, benefits fade without repeated sessions. EWOT and HBOT work very differently, despite both using oxygen therapeutically. EWOT combines exercise with high-flow oxygen, while HBOT delivers oxygen under pressure inside a chamber. EWOT is shown to stimulate angiogenesis and support microvascular repair, whereas HBOT generally provides a temporary oxygen boost without driving the same remodeling effects. For chronic disease, EWOT tends to target root cause metabolic and vascular dysfunction, while HBOT is more commonly used for symptom management. In acute medical crises such as burns or gangrene, HBOT remains the gold standard, though EWOT can still play a supportive role for recovery, including post-surgery. EWOT is far more accessible, with home or gym setups typically costing $1,000 to $5,000. while HBOT is limited to clinical environments and usually costs $200 to $500 per session. Over the long term, EWOT promotes cumulative vascular and metabolic improvements, whereas HBOT requires continuous sessions to maintain benefits. Why dissolved O2 matters? While 98.5% of oxygen is hemoglobin bound, dissolved O2, 1.5%, is critical for endothelial cells. Use dissolved O2 for ROS signaling, H2O2, to regulate nitric oxide, vasodilation, and inflammation, parasites, capillary gatekeepers, sentinels, watchmen. Rely on PO2 gradients to maintain ATP for capillary tone. Low PO2 leads to ATP depletion, which causes parasite swelling and results in capillary constriction. Note, parasites are not the same as smooth muscle cells. Parasites. These are stem cells in their sentinel mode, monitoring conditions, assisting with vascular tone, ready to respond to damage. When damage is sensed, their full stem cell mode is activated, allowing them to differentiate into the appropriate cell type to perform the repair process. Smooth muscle cells, terminally differentiated, control systemic blood pressure in arteries, veins. Post-stroke, HBOT helps reduce acute brain swelling, while EWOT supports the rebuilding of capillary networks. Diabetic ulcer, HBOT helps jumpstart the initial healing process, while EWOT works to restore long-term limb circulation, long COVID. Combine both to repair mitochondria and the microvasculature system. Your microvascular system isn't self-healing. Choose your therapy. EWOT for chronic disease, aging, and mitochondrial revival. HBOT for acute trauma, infections, and wound healing. Your capillaries aren't lazy, they're suffocating. EWOT's the oxygen mask they've been gasping for. Ready to breathe new life into your cells? Explore EWOT and HBOT protocols at the STEM Regan/Age Reversal Technology Center. Visit ARTC.health or call 9418-065511.